Donor support for family planning and reproductive health programs is on the increase after many years of stagnant funding. But decision makers in both donor and recipient countries still face financial constraints. Before they commit resources to these programs, they need to know that the programs will have worthwhile results. Do family planning and reproductive health programs matter? Do they work? The Hewlett Foundation formed a research network to investigate these questions. It partnered with several European research councils, the World Bank, and U.S.-based groups to create the Population and Poverty Research Network, PopPov. Researchers in the network use improved data and research methods to assess the effectiveness of family planning and reproductive health programs. Their findings indicate that, yes, these programs do work. Let's take a closer look. PopPov researchers ask whether investments in reproductive health are important to the achievement of big-picture goals, such as poverty reduction, economic growth, political stability, and preservation of the environment. They ask whether interventions help achieve goals. Do they enable couples to have the number of children they want when they want them? Do they improve an individual's chances of escaping poverty? Do they benefit society by lowering fertility, which in turn results in less pressure on public spending? PopPov seeks to answer key questions like, is poverty the result of having more children, or does being poor lead to having more children? Existing studies have identified a variety of factors that influence fertility and childbearing, but few have untangled cause and effect. PopPov network researchers use various approaches to distinguish cause from effect. One approach is randomized design. In randomized design, researchers observe two groups of randomly selected individuals. One group receives services and one does not. By comparing the two groups before and after the intervention, researchers can begin to separate causes from effects. Researchers in Malawi use randomized design to study the different effects that providing cash transfers can have. They found that providing cash transfers directly to schoolgirls had the biggest impact on preventing HIV infection and keeping the girls in school. PopPov research provides decision makers with a stronger evidence base for investment decisions. Do reproductive health and family planning programs produce results that justify the costs? One approach to answering this question is to weigh costs against outcomes. In Uganda, a PopPov study provided convincing evidence that society and individuals could realize significant benefits through increased productivity as a result of increased investments in family planning. With better access to family planning to avoid unintended pregnancies, fewer women rely on unsafe abortion. Preventing unsafe abortion also reduces healthcare expenditures. PopPov research also considers how investments in reproductive health and family planning can produce positive results at both the national and household levels. For example, PopPov studies in Bangladesh found that bringing family planning and other services to women in their households in a designed experiment led to increased contraceptive use and lower fertility than in the control area. Moreover, program effects were sustained over several decades. PopPov has helped to revive interest in research needed to assess the case for reproductive health and family planning programs. As Dr. Nistha Sinha of the World Bank points out, this research is helping narrow the gap between research and policy.
Of India and similar countries which have similar problems, I would definitely like to see more researchers, in fact, trying to answer the question of whether these kind of policies work, even though the data might be less than perfect. There are methodologies available to try to measure the impact and therefore narrow the gap between research and policy.
Through rigorous studies such as these, the PopPov Research Network is showing that reproductive health and family planning programs do matter for poverty reduction and economic growth. These programs do work.